Hello everyone, welcome to BCAT. This is Back Talk and my name is Mark Ghani. I'm here with Dr. Gurman and Dr. Campbell. Dr. Gurman?
Hey Mark, pleasure to meet you.
Dr. Campbell?
Nice to meet you, Mark.
First question I want to ask you is, what's the most common problem people come to your office with?
Well, Mark, I wouldn't say there's any one specific most common condition. It really varies. I mean, we have patients that come in that were involved in motor vehicle accidents, sports-related injuries, maybe someone slips and falls on the ice or down a flight of steps. There's not one specific one. We even have a lot of patients that actually just come in because they woke up with some type of pain. I don't know if that's ever happened to yourself, but sometimes you wake up with maybe some neck pain where you can barely even move your head, possibly can't make it to work because it's that severe, the pain. Even with lower back, same thing. Sometimes somebody just wakes up and they have that much pain.
What exactly is conservative care and why is it important?
Well, conservative care is basically stands for non-invasive care, meaning possibly avoiding surgery or any type of invasive care. And it's very important because you can help if you can heal yourself naturally by using rehabilitative exercises, rehabilitative type of care. Why would you want to go and get surgery, or why would you want to possibly take a long-term medication that may have some side effects? It's important also because it's going to really help to correct the problem and possibly change the way that you do your activities that may have caused the problem.
More time consuming on the patient's part though. It takes a little more time and energy because you are doing some of the exercises trying to rehabilitate that area of injury. So it's not really the easy way out.
This is a question neither one of you can answer. When it comes to heat or ice, which should I use and under what conditions?
From the first 24 to 48 hours, say for example, if you were walking down the stairs and you slipped, that would be the injury or the trauma. You'd want to, from that point, anywhere from 24 to 48 hours, you'd want to ice that down. It's going to affect it in two ways. It's going to slow down the blood being brought into the area, which would bring in that inflammation, as well as it would mediate the pain. It's going to be a natural anesthetic. Anytime after that 48 hours, it's a semi-acute to a chronic type of injury. You'd want to bring in a heat to that area. Once you injure a tissue, it's going to bring metabolic waste into the tissue. So heat will actually bring blood in and kind of wipe out any of the metabolic waste that's built up in that either that joint or that muscle that's injured, enabling it to heal, feeding that injured tissue, as well as loosening up that injured tissue. The one thing you want to be careful with is you want to make sure that heat is a moist heat though. If you use a dry heat, you'll actually dehydrate the muscle. So it should be some type of moist heat. And if you're not sure whether to use heat or ice, it's more or less you can never go wrong with using ice, but you can actually injure the area more if you use heat. So your best bet is to contact your physician.
Do you deal with more rehabilitative work or chronic conditions? Which one?
Well, we treat the patient with rehabilitative work. A lot of patients have chronic problems, but usually when they come to us, they're in an acute stage of that problem. Where when I say acute, it means they just re-exacerbated the pain that they may have been having somewhere along the line. And then, a lot of them are chronic problems that they've had prior to, and it just keeps coming back. Then we use the rehabilitation to help try and correct that problem to avoid it from coming back in the future.
Why wouldn't it be wise for the average person to just say, oh, I hurt my back, let me just go to a drugstore and get some medicine?
Well, the average person doesn't really, most average people don't really have the education to determine, or the diagnostic tools to determine whether or not the injury is serious or it's not.
What about medication?
Medication is it's not always a bad thing. I definitely won't say that, because there's a lot of instances where we have a patient that's in so much pain they can't go through the rehabilitative care, or they can't function day to day. And as you know, everyone has to wake up and go to work in the morning, and it's tough when you're in a lot of pain. So sometimes it works as a gateway as part of their correction, but it's not something you really want to take long term. I mean, typical medications that we see patients on would be an anti-inflammatory, help bring down the swelling or any type of joint pain. Also painkillers, which will just help, painkillers, muscle relaxers, which will just help to relax the muscle spasm and obviously reduce the pain while they're functioning day to day. But it's something you really don't want to get in the habit of any long-term medication to just mask the problem.
Right. What about arthritis?
Anytime you have an injury earlier in life, if left uncorrected, you change the biomechanics of that joint. And typically, when you have an injury long-standing, that joint will actually start to degenerate. I actually have some models over here of arthritis in the spine. This is a typical vertebrae right here, typical joint. That would be the disc that sits in between these two vertebrae that cushion those two vertebrae. As you can see from here, I want you to notice the disc height. There's really no loss in disc height itself. That would be the moving joint of that vertebrae and back. Arthritis, in its first stage, in the spine, you'll actually start to lose some of that disc height. You'll start getting that disc to bulge. In the second stage, you start getting, it's called an osteophyte or bony outgrowths, which is common with an arthritic profile in any type of joint. That joint will actually start to fuse and produce bone in between the joint, actually. And this would be the last and final stage. That would be a severe arthritis, and you can actually see the difference from that joint to that joint, where you start getting bony growths in between the joint itself.
Do most of these injuries heal on their own?
As I was saying before, I mean, they heal on their own to some degree, and some may totally heal on their own, depending on the severity of the injury. Without getting a proper diagnosis, though, without going for some type of care, you will never know for sure until down the road, where it may pose another problem, or it may get worse. An instance like the disc herniation, and I think my feeling is that you should always get some type of diagnosis to make sure of what it is, what the problem is that you're having, and then find out, well, is this something minor that may actually heal on their own, and let the doctor tell you, yes, this is something minor, or should I get some kind of rehabilitation for this problem, or you may even need surgery depending on the severity again, and fix the problem the right way, rather than just taking a guess that, oh, well, I'm out of pain, so the problem no longer exists.
What are some misconceptions about back pain?
I'd say one of the biggest misconceptions about it is just as you said, it's referred to as back pain, and patients associate the pain with the problem.
What can I do to prevent injuries and problems with my back?
We're going to go over quite a few stretches and kind of preventative everyday tips in the next segment, but I want you to understand, and the viewers at home to understand, if they do have a problem, you should always consult a physician before trying any of these stretches.
We can do that now?
Yeah.
Well, let's do it.
Let's start. All right, Mark, next we're going to go over some everyday things to kind of prevent any injuries from happening. One of the most important things you could do for yourself is to be in an ideal weight. The more weight you have on your body, the more compression you're going to have on your skeletal systems, possibly leading to some type of injury. You can moderate your weight by doing one of two things: diet, most important, and exercise. We're going to dive in and talk about exercise for a little while.
Okay.
Just some everyday tips that you could do for exercise is, for example, if you come home from work and you live on the 6th floor, well, instead of taking that elevator every time, why don't you take the stairs? If you live 5 blocks away from the next bus stop, or if you have a bus stop right out front, just start to implement walking to that next bus stop. Certain things like this, it's going to add your activity level, especially if you're an office worker, if if you're sitting at your desk all day long and you're not getting that activity that you need.
So you're saying, like, if you, instead of taking the elevator, if it's a couple of floors, just take the stairs, and just stay in motion.
Exactly.
Keep your activity going.
Well, number one, that's going to expend energy throughout the day, which is going to burn calories. You're going to lose weight, as well as sedentary lifestyles, you're more prone to injury. That leads us to lifting. You're actually sitting on one of the boxes that we're going to demonstrate. I'm going to have you demonstrate how to lift up some type of object.
Okay, so I can do that now?
Yeah, please.
Okay. Alrighty.
Okay, perfect. You did exactly what I wanted you to do for demonstration purposes. If you could drop that down for me.
Okay.
You lifted with your back, okay? So that's going to put a lot of stress on your back. Let me show you what exactly you're going to do, and I'm going to have you go over it again.
Okay.
When you're lifting an object, ideally what you'd like to do is to get down on one knee, okay?
All right.
Get a nice firm grip on that. Okay, you're going to squeeze your stomach, and instead of you lifting with your back, you're going to lift with your legs. Okay, so
So from this
slowly,
position?
yep, exactly, and you're going to slowly bring it into your belt section. Perfect. And then when you're going to move with it, you're not twisting, you're moving your feet. So when you walk away, walk with your feet.
Okay.
Perfect. And I like what you're doing right now. You're keeping that nice and close to your belt line, and you should be squeezing your stomach at all times. Okay. If you could drop that down, when you come back down, you're using your legs. You're not using your back.
You're
Perfect.
just placing it down.
Exactly. If you're standing in a position all day long, this is a type of repetitive stress, almost as if you were an office worker sitting in a position all day long. Okay, so you always want to, move around, not stay in that fixed position. That's when you're going to run into problems.
Okay.
So one of the things with a factory worker, for example, you want to just grab some type of low box just like this, all right? And when you're working, it's as simple as just throwing that box underneath you, placing one foot on top of it. You're taking the stress off your low back. You're changing your work environment. You can put a little pressure on that leg. And then stand there for 20 minutes, and then just move the box over. Put your other leg up. That leads to we can actually use this box. A lot of people, depending on what their job is, for example, someone that works in a retail store that's on their feet all day long, or even the factory worker that's standing on an assembly line. Shoe wear is very important. Going back to that retail person, I get a lot of females in the retail business that come into the office and complain about, what type of day does your back hurt? Well, it's usually at the end of the day or during work. Okay, well, you're on your feet all day long. What type of shoes are you wearing?
Right.
I wear high heels. Okay, well, that's going to put abnormal stresses in your low back. So in an ideal situation, you want to wear a flat or a lower heel than some of the heels that you see out there today are 6 to 8 inches high. You want to try to stay away from that, especially if you're going to be on your feet all day long.
Right.
Or for the male, you want a nice cushion in your shoe, a nice comfortable shoe that's going to give your whole body a support.
Some of the things, we're going to be going over a couple of things. The first one being for people that are sitting for long periods of time, whether they're sitting at home, job related, sitting at a computer station, recreational or work related.
Right.
We're also going to be going over a proper way to carry anything with you. For instance, a student, how to use a proper backpack, why a backpack is better to use. And then at the end, we'll wrap it up with some relaxation techniques.
Okay.
So first thing I'm going to start with is a backpack. One great thing about this backpack is that it has proper support. On the back, you have a nice soft surface, but inside there's a plastic piece that contours to your spine.
Okay.
That's especially important because sometimes if you're carrying textbooks or other objects that are of a weird shape, they won't be pressing into your spine. It'll still keep a proper contour of your spine. This also has a waistband support and some side pockets to distribute the weight to keep it as close as possible to your body.
Okay.
I'd like you to just put this backpack on and show me how you would normally carry a backpack.
Usually like this.
Usually like that. And that's what I was hoping that you would do, because that's one of the worst ways to carry a backpack. What you really want to do is get both of your shoulders on there. A lot of chairs nowadays, especially office chairs, come with some type of lumbar support for your lower back, because we naturally have a curve in our lower back, so we want to keep that curve. We don't want to take it out, especially if we're sitting for 8 hours a day.
Right.
And no longer is it just a work thing where people are sitting for long periods. Now a lot of people are coming home and working at their computer station for 4 or 5 hours at a time, or just sitting in front of the TV. So having a good type of support is very helpful. If you want to take a seat for me, I'll show you some other things. You want to move that support right up into the middle of your back where it feels comfortable, where you feel you should have that curve. I feel comfortable to
Yes.
you? Okay. See, this chair is a nice height. In a lot of office chairs, you want to have it so that your knees are at a 90 degree. Also, if you're working at a computer, you want the computer set up so that you're basically at a 90, your keyboard's down here. One of the most important things that I see that people set up wrong, their computer station, you want your monitor in front of you and at eye level. Another thing you want to do is to help relax, you want to do some breathing techniques. If you're real stressed out, you can maybe just take a few minutes while you're stretching, stand up, take 10 deep breaths. Breathe in, take them right in through your stomach, breathe out, and just really kind of focus everything out that's stressing you. Relax. It doesn't sound like much, but at the end of the day, it makes a big difference. And if you start doing these exercises and using the proper equipment, keeping your monitor in a proper place and doing everything right, you'll notice in long term that you'll have a lot less pain.
Hi, Mark. This is Mary. She's going to be demonstrating some of the stretches for us today. What we're going to do is we're going to go over some daily stretches you can do to prevent any type of back injuries. First and foremost, if you have any injuries or you think you might have an injury, you always want to consult a physician before you perform these stretches. All the groups of stretches that we're going to do are typically tight, posturally speaking, in human beings. First group of stretches that we're going to do are for your neck and your upper back. And what you have to understand is, if you have a neck problem that's connected, most of the muscles are connected to your shoulders. So we're going to be stretching shoulders and your neck. And for your low back, we're going to be doing a lot of leg stretches, which also most of those muscles connect to your pelvis and low back. So if I could demonstrate this on this wall, what you're going to do is you're going to put your hand on that wall right above your head, about 45 degrees. What you're going to do is you're going to turn your head away from the area of stretch, and you're going to turn your feet with you. Okay, perfect. And you're going to gently lean into that stretch. And the area that you should feel that stretch is all on the front of that shoulder and in your chest, okay? And the most important thing that you're going to do through all these stretches is nice, relaxing breathing. In through your nose, out through your mouth. And the other side, perfect. And you're just gently going to stretch into it. You don't want to stretch into it too hard where you feel pain. You should feel a slight pull on that muscle. Perfect. Those stretches, by the way, you're going to hold anywhere from 30 seconds to a minute. And that goes for the rest of these stretches. I'm going to grab a chair. This next group of stretches is great for office workers and people that are sitting at their desk all day long. If you could just take a seat nice and straight up for me, please. Great, perfect. This is going to stretch the side of your neck, all the muscles associated, one of them being your upper trapezius. Mary, what you're going to do is you're going to take your hand and just grip onto the side of that chair for me. You're not pulling down with the shoulder, you're just anchoring with that hand to hold that shoulder down, okay? Your other hand's going to come over here. You're going to grab the side of your head. And once again, you're just anchoring the shoulder, and you're going to slowly pull this section of your shoulder straight apart. Great. 30 seconds to a minute, okay? And you're going to repeat. Always repeat both sides. That side. Perfect. Next stretch, what we're going to do is called a head circle. Okay. Mary, what you're going to do is you're going to bring your head to your chin as far as you can. You're going to relax these shoulders. All the motion's going to be in your neck. And you're going to slowly, you can either start clockwise or counterclockwise. You're going to do a complete circle with your head going to the farthest extremes of that rotation. Okay, back, all the way to the side. Bring that all the way to the front. And she's doing it perfectly. She's doing it nice and slow, and she's really feeling that stretch. I would go 5 times one way, then 5 times the other way. And then slowly bring that around. All the way to the side and to the front. Perfect. If you could stand up for me, Mary. The next group of stretches that we are going to do are more for your low back and your mid back. What Mary's going to do now is she's going to lay down on her back, and I recommend doing these stretches on a firm surface, preferably a floor. You can just throw a towel, lay right down on the towel. And if you can notice on Mary, her head is totally straight. This is going to actually stretch out her entire back. It's going to emphasize her low back and mid back, though. The first stretch that we're going to do is going to be a knee to chest. She's in a hook lying position with her legs up just like that. It's going to take the stress off of her low back by doing it this way. She is going to bring one knee. You're going to grab your knee and slowly pull that knee to chest. The next stretch is going to be knee to opposite chest. And that'll just stretch out your entire back, your leg, and your low back. And all these stretches, once again, are going to be anywhere from 30 seconds to a minute. And you're going to repeat both sides, as I said before. Knee to chest, and knee to opposite chest. Perfect. The next stretch we're going to be doing is called the double knee to chest, and we're going to do a couple different positions with this. The first position, very important, you want to bring your knees together and your ankles together. You're going to feel this stretch directly across your belt line and your low back. Very slowly bring that up. You're going to grab both of your knees, Mary, and you're going to slowly bring that right to your chest, making sure that those knees and those ankles are as close as possible together. And you're breathing throughout all of these stretches. Okay? Position number 2, this will get a little bit higher on your back, more towards your mid-back. You're going to cross your legs, just spread your knees out a little bit, and then once again, bring that knee to chest. Perfect. Okay? The next position, cross your legs in the opposite, bring that straight back. Perfect. Breathing the whole way through these and 30 seconds to a minute on each one of these stretches. Drop that down. The next stretch we're going to do is for your hamstrings, which is a muscle that connects all the way from your knee all the way up to your buttocks. You're going to grab a rope at home. You can grab a towel. And what you're going to do is you're going to bring this leg up. You're going to wrap that towel or rope right around your foot as such. You're going to grab that rope or towel, and you're going to straighten this leg up. Perfect. And make sure that leg is totally straight, and you're going to feel a stretch all the way through the back of your leg. Good. Okay? And you're going to repeat to the opposite side. And once again, notice that she has her leg totally straight. Great. What you're going to do is you're going to step off the bench, and you are going to get down on one knee. You're going to face the camera sideways if you would. You're going to get down on one knee. If you have knee problems, I would recommend just putting a small pad under the knee just for a little support. Mary, you're going to take that front foot and move it just a little bit more far forward. Yep, exactly. Okay, not that far, right about there. You're going to make sure you're nice and straight, looking straight ahead. You're not letting your stomach come out like that. Nice and straight. And just slowly fall into this leg right here. Perfect. And you should feel a stretch on the front of your leg all the way through here. Okay? Perfect. And if you could turn around, and we'll do the same on this side. Once again, one knee, put your other foot forward, looking straight ahead, nice and tall, and just slowly fall into that hip. Good. And you should feel the stretch all in the front of your leg. Perfect. 30 seconds to a minute on each leg. Good job, Mary.
If anyone needs any information, where can they locate you?
Well, the name of our office is the Heights Chiropractic and Rehabilitation, and we're located on Remsen Street in Brooklyn Heights, between Court Street and Clinton Street.
Very good. Well, it was great having you here. I appreciate all of the tips that you gave us today, the exercises. Dr. Gurman.
Mark, pleasure to meet you. Thanks for coming down.
Dr. Campbell.
Nice to meet you, Mark. Thank you.
This is BCAT Television. My name is Mark Ghani. You've been with us on Back Talk, and we'll talk to you later.